Okay, so we're going to keep going here on this respiratory thing. It looks to me like we are going to probably get done with this today. And then we'll Zoom tomorrow for a review. I will send you, let's see, I will send you a review, quiz review. I think there's a quiz review too right there. Yep, there it is. So I'll send that to you here in just a few minutes, okay? But regardless, we're going to finish this up today, so I'll do a little bit of a review and then we'll keep going. So, uh, when we talk about ventilation, when we talk about the ability for air to come in and out of us, we're talking about there's some physical factors that are involved with that. Okay, um, one of them is that the respiratory passage needs to be free and clear. Nothing lodged in there, nothing growing in there, nothing filled with mucus or garbage or whatever else, right? So we want that airway to be clear. We want the lung to be able to expand easily, and we want the lung to be able to retract back, be elastic, and return to the shape again. And then also we want these surface tension forces that are there in the alveoli to break that surface tension so that oxygen and carbon dioxide can cross that membrane and make it into the bloodstream or out of the bloodstream. Okay? So, as we keep going here, so respiratory passage resistance. Okay, so like I said, we want that airway free and clear, right? Don't want friction. We want that to go through. Okay, so like down here we talked about this local accumulations, right, of mucus or whatever, and fungal infections and tumors and all that kind of stuff. We don't want that in there. But also we have this whole smooth muscle thing going on here too, where if we get some vasoconstriction due to the smooth muscles, you can get, that's what asthma is, right? It's where these smooth muscles are spasming, they're freaking out, they're cutting down on that airway, and air is unable to get in or out of the system. Okay? And so there's your asthma. So here we are, we have our bronchus. Okay, we have smooth muscle here and a normal airway. We have plenty of stuff going on here. When we have some inflammation in this bronchus, we can see that the smooth muscle is, that layer is inflamed, it's contracting, and it has caused that airway to be more narrow. So getting a breathing treatment or whatever else, you are inhaling a steroid, which is causing this muscle and this inflammation to chill and then get to more like this so air can go in and out of you. Okay. Lung compliance, we want the lungs to be easily and readily expandable. When you take a deep breath and you bring that air in, you want that to be easy. You want those lungs to fill up and to expand easily. Okay? It's affected by the elasticity of the lungs and thoracic cage, right? Okay, so if the thoracic cage will not expand, then neither is your lungs. Excuse me, I'm having a problem here. Or not very much. So it's either not going to expand. If the rib cage will not expand, the lungs will only expand a small amount. All right, we got two factors here that help with this compliance. Okay, the ability for it to expand easily is a fibrosis of the lung, right? We don't want fibrosis. When we talk about healing, we're talking about regeneration. We don't want fibrosis. So repeated exposure to things can cause fibrosis of lung tissue. All right, so now we're losing the ability for the lungs to expand well, and we're losing the ability for them to contract or to recoil again. That's elasticity, right? So ossification and or muscle paralysis can impair the flexibility of the thoracic cage as well. We lose the ability for some of our rib muscles to expand the thoracic cavity so that we create an increased amount of volume, right? So that whole Boyle's law The bigger the volume, the lower the pressure. The smaller the volume, the bigger the pressure. Well, anyway, when we're talking about inspiration, we're talking bringing lung air in. We want the volume to get bigger, which the pressure goes down, which is going to drive air into us. Okay. So here we are. This does not look like good, healthy lung tissue. See this white? You're talking about fibrosis. You're talking healing by fibrosis. And when we talk about fibrosis, scar tissue, that is a tough, thick tissue. And when we're talking about this bag of this soft, delicate tissue, all these air sacs, and now we're having all this fibrosis laced through it, that's going to affect the ability for it to expand when we have a bunch of scar tissue in there. So when we talk about lung elasticity, that's essential for expiration, right? So if you, it's kind of like blowing air into a balloon and then letting off, and that balloon returns back to this original shape. Well, in doing so, it pushes the air out. So if our lungs are not elastic, we are not going to get normal expiration. Now, we can get some expiration, and we'll get it through the diaphragm relaxing back up and cutting down the volume, and probably some intercostal muscles that are going to have to contract as well to force air out. But as far as normal expiration, you're always going to have to work hard at exhaling if these lungs are not elastic. All right, just imagine blowing up a balloon and then letting off of the open end, and it doesn't shrink back down. It just kind of stays the shape that you blew it. That would be weird. I don't think we don't even comprehend that. But that's kind of what I want you to think about when you think about that lung. We put air into it, it expands out, and if we would normally see that thing would kind of come back and return to shape. And if we've lost lung elasticity, we're not going to see that readily return to pre-breath shape. Okay. So emphysema, we've heard of that. Okay. The tissue becomes less elastic and more fibrous, right? So again, here we're talking about fibrosis again. So we're talking about emphysema is where we get air in the lung, but it's kind of like we're having difficulty getting it out, right? So loss of elasticity, increases in fiber tissue, causes enormous effort to exhale, right? At the end stages, alveolar walls break down and surface area is lost for gas exchange, right? So if we hold the pressure inside and we can't get it out, that's going to damage those thin, delicate, simple, squamous tissue layers, and we're going to see breakdown of those walls, which means we're going to see a decreased amount of surface area, which is going to not allow us to exchange gas as well. Okay? So smoking is going to repeatedly damage, and cause problems with the lung, whether it be compliance, elasticity, emphysema, and fibrosis of the lung. You can see where we have not only difficulty getting in and air out, but we have to work hard to get it in and out, and then we've broken down walls and we don't have as much gas exchange. All right, so that is that's an issue. So hardly anybody's watching, so hello to the one person out there. Anyway, let's keep going here. Maybe two of you. Anyway, so we got our emphysema. And so if we look at what an emphysema lung kind of looks like here, we can see how, if you look on the left, okay, I know you're all looking at the right because you're like, ooh, disgusting, that thing is whatever. But what you're seeing is those black spots. You're seeing those alveoli walls being broken down. Like over here, if we look, this normal thing, I always say like grape clusters or something like that. But here, we're not seeing that. We're seeing very few walls, very few grapes, or however you want, alveoli, or whatever you want to say it. And so the amount of surface area, because now we have gas exchange happening all around these individual things. Now, when you talk about this, and you're talking about a little bit there, and it's way different, okay? And again, when you talk about a healthy lung, that does not look healthy. That looks like you left it on the grill too long and it got burnt, right? So we're talking about lung elasticity. The lung would expand, but yet it would not recoil back, and therefore the lung is it's stress on the alveolar walls. They break down, then you lose surface area. Okay, you see what I'm saying? Okay, you got it. You can listen to it again if you don't get it. Alveolar surface tension forces, right? So the surface tension is caused by the tendency of polar molecules such as water to stick with each other with hydrogen bonds, right? So we've done that thing where you've put a needle on top of a beaker of water or something, and you've seen it float, right? That is surface tension, right? That is the polar molecules, the water and the hydrogen bonds, and it's you've seen it, okay? This this can cause the walls of the alveoli to stick together like plastic wrap every time you exhale. So we don't want them to stick together, right? We don't want that. You know how annoying it is when plastic wrap touches, okay? So if you mess with these surface tension forces, they can end up sticking, all these alveoli walls can kind of stick together. So large amounts of energy then are going to have to be, um, you know, expelled, or you're going to have to spend a lot of energy to pop open those things again and get them to separate, okay? Now, in the grand scheme of things, is it that hard to do? Probably not. But the problem is that when you have something like this and this is an issue, then now, again, what normally would take a certain amount of energy for normal respiration becomes a whole nother amount of energy. And so now you've got to work hard just to breathe in and breathe out, because you've got to breathe in harder in order to not pop, but inflate all of those alveoli sacs, because they've been stuck together, and you got to get them to separate and blow back up. And so while we all think, no big deal, but remember the amount of surface tension, or not surface area, how many of them that there are. And so there we're going to wear ourselves out breathing, okay? And so large amounts of energy and effort will have to be done in order for us to re-expand the lungs and allow you to inhale. So ERDs, okay? Surfactant is what interferes with that, right? It interferes with that cohesion, those two plastic wrap alveoli walls. It kind of it messes with that and doesn't allow them to adhere, right? So it messes with that water molecule so that less energy can go into expanding the lungs, right? This is one of the things that keeps our lungs partially expanded at all times, okay? So not all those, so if we didn't have it, then the tendency would every time we would exhale and those air would go out of those alveolar sacs, if we didn't have surfactant present, all those thin membranes would want to stick together, and then we'd have to take a big, strong, deep breath in order for us to inflate all those little things again, okay? And so with surfactant, when we have this, it keeps our lungs from collapsing. It keeps us from having to work so hard to blow them back up again, okay? Surfactant is secreted by type 2 cells in the lungs. That's probably a test question because it's easy and it's on there, and I can say, see, I told you, Garrett. All right, so we have our type 2 cell. And it is secreting some surfactant, okay? Alveolar surface tension, okay? In low lung volume, surface tension is directed inward because water particles on the walls want to interact, right? When we have water out here, when it's inflated, they're kind of far away from each other, okay? But when we expire and that air leaves, that brings the walls closer together, and the tendency is that water will be attracted and it will kind of go close to each other, and that's where you would see the saran wrap wanting to stick to each other, okay? In high lung volume, surface tension is outwards because the water particles on the walls are pulled towards the bulk water outside, right? So when we have tissue fluid, or we have fluid outside of the alveoli, the blood, the whatever it would be, that water is attracted to what's on the outside. But when we exhale, it brings them closer together, and those water molecules want to get attracted to each other and collapse that air-filled sac. Okay, but that's what surfactant does. It keeps that airspace. It keeps those polar molecules, those water molecules, the polarity of them, from being attracted to one another and collapsing that down. I hope that makes sense. Anyway, ERDS, infant respiratory distress syndrome, okay, hyaline membrane disease caused by lack of surfactant due to prematurity, okay. So if you have a child, if you have a child that is born before 28 weeks, it is a good chance that they are going to have an issue with breathing. They are going to have to work really hard to breathe in and breathe out just because they have to keep popping or inflating all of these alveolar sacs. So most of the time when babies are pre 28 weeks, 29, everybody's different, right? But generally they are going to be put on a ventilator. Okay? And the ventilator takes the stress off the baby from having to work so hard to breathe. So babies can wear themselves out trying to breathe, right? They can just, all their energy gets robbed to the breathing, and the other systems aren't getting the energy that they need. Does that make sense? Yes, it does. Anyway, so my niece, preemie, right? She was born 16. She was born 26 weeks. Now, amazingly enough, she never was on a ventilator, and so maybe she just developed this surfactant early in her lungs, and she just never required it. She wasn't laboring. She wasn't under respiratory stress, and they did not put her on a ventilator, which was really, frankly, amazing because we were kind of expecting that. But they did have oxygen in her nose, but they were not ventilators where they are forcing air in and out of here. That was not her. Okay, so we have ERDs here, right? Premature babies. They haven't had the cells that haven't developed in the lung like they should, so we don't have surfactant, which makes it hard, which means baby has to work really, really hard in order to breathe. We talked about the lung compliance. We want the ability for it to expand easily, and when it doesn't, it's usually by fibrosis, and that don't look good. Lung elasticity, we want it to be able to recoil back down and push air out. That's emphysema, and if we leave that pressure high, we're going to start messing with these alveolar walls. When we start doing that, removing that, we remove surface area for that gas exchange, which means we can breathe oxygen in, but if we don't have all the surface area to match up with the vessels, we're not going to have good oxygenation of the blood, which means our respiration is going to go up, our heart's going to have to work harder, all that kind of stuff is going to go on there, right? And we don't want anything in the lung. We don't want inflammation of the tissues or whatever, okay? So tomorrow what we're going to do is, so that's the end of quiz 2, okay? So that's the end of quiz 2. I probably have to send you, let me see if do I have to send you another PowerPoint? I don't think I do. No, I don't. Okay, so that's the end of quiz 2. I'm going to send this review sheet over. Okay, I want you to do it. I want you to finish it. We'll go over it tomorrow, and you can ask me questions tomorrow on this review sheet. Okay, and if you are there for the Zoom, then I'll just count you as whatever. If you don't, then you're gonna have to send it to me. So you tell everybody. It'd be nice to see everybody. But anyway, I'm gonna send that out right now. We'll do quiz. We'll do the quiz probably Wednesday. So we'll do a review tomorrow. We'll do the quiz on Wednesday. I will be on Wednesday. We will lecture through Wednesday, but I will give you the day to do the quiz. Make sure you get your stuff turned in, and I will see you guys tomorrow with any questions. I'm going to send this out right now. All right? You guys have a great day, and I will talk to you later.